Hello, and welcome to Module 1 of the Rapid Hepatitis C Study, Peer Mentor Training. I want to first go over the purpose of this study. Hepatitis C is a life-threatening infection that affects about 150 million people globally. People who use drugs are at increased risk for hepatitis C. Hepatitis C infection kills thousands of people every year, but hepatitis C can be cured. However, many people who use drugs have not been treated for hepatitis C, and increasing the number of people that start and adhere to hepatitis C treatment is a priority. This study then aims to see if a peer mentor program can improve the initiation, adherence, and cure of hepatitis C in people in drug treatment. This is a training overview of all of the modules that you will complete as part of your peer mentorship training. So Module 1, which is this module, will go over facts about hepatitis C virus and treatment. Module 2 will be about peer mentorship roles and readiness. Module 3 will be about how to develop supportive relationships with your mentees. Module 4 will be the peer check-in structure. Module 5 will go in depth about the first check-in you will do with participants, and Module 6 will be a guidance for site coordinators. So you only have to watch that video if you are a site coordinator. And these are the training objectives for the training modules. So this is to first learn the facts about hepatitis C and the liver. You will also be provided with an overview of the Rapid Hepatitis C program. You will understand your role in the Rapid Hepatitis C program. You will be prepared for your telephone calls with your mentee. And lastly, we will review the importance of confidentiality and privacy. The objective of this first training is to learn facts about hepatitis C and its treatment. There are 3 common types of hepatitis that you may have heard of. There's hepatitis A, hepatitis B, and hepatitis C. Hepatitis A is a contagious liver infection caused by the hepatitis A virus. The hepatitis A virus is found in the stool, also known as feces, of people with hepatitis A infection. It enters the body through the mouth after somebody handles something contaminated with the hepatitis A virus or eats or drinks something contaminated with the hepatitis A virus. Hepatitis B is a contagious liver infection caused by the hepatitis B virus. Hepatitis B virus is found in the blood of people with the hepatitis B infection. It enters the body through blood-to-blood contact. And now we'll talk about hepatitis C, which is the focus of our program. Here are some hepatitis C facts and numbers. The hepatitis C virus was first identified in 1989. And hepatitis C is the most common cause of death due to an infection in the United States. 50 to 80% of people who use drugs have been infected with hepatitis C, and about 1 in 2 or half of people with hepatitis C don't know that they have it. The good news is that 9 out of 10 people who take the treatment have been cured. However, most people with hepatitis C have not been cured. Hepatitis C is transmitted primarily through blood-to-blood contact, but most people don't know when, how, or where they were infected. So it's important to not focus on how someone got hepatitis C, but the steps they are taking to improve their health and well-being. It's also important to know the things that do not spread hepatitis C. So hepatitis C is not spread through sneezing or coughing, sharing food, or hugging or kissing. As peer mentors, part of what you can do is take this knowledge and help tackle some of the myths to be able to help people know the things that do and do not actually spread hepatitis C. As we learned before, 1 in 2 people who have hepatitis C do not know that they have it. And one reason for this is that most people have no symptoms. Others have symptoms like abdominal pain, feeling tired, or loss of appetite. But the only way to know for sure if someone has hepatitis C is for them to get tested for it. If someone has hepatitis C and does not get treatment, there can be serious health problems. These health problems include liver damage, liver cancer, and death. Importantly, hepatitis C is the #1 cause of liver cancer and liver transplants. Luckily, there's a cure for hepatitis C, and your job as peer mentors will be to help people with hepatitis C get the treatment needed to cure hepatitis C. The current treatment for hepatitis C is highly effective with a cure rate of over 99%. The hepatitis C treatment we are using in this program is called Mavyret. It was approved by the Food and Drug Administration in 2017. And for this treatment, people will take 3 pills every day for a total of 8 weeks. It's important to highlight that the medication needs to be taken with food for it to work the best. Most people do not experience any side effects when they are getting treated for hepatitis C. A small number of people report side effects such as headaches, fatigue, and nausea. These side effects usually go away on their own after about 2 weeks. Adherence to the treatment is the key to being cured of hepatitis C. And when I say adherence, I mean the extent to which people take their medication as prescribed. So that means that the extent to which participants take their 3 pills a day for 8 weeks. And as part of your work as a peer mentor, you'll be helping your participants overcome barriers that they face trying to adhere to their hepatitis C treatment. So what are some of the biggest barriers to adhering to hepatitis C treatment? You are the experts here, so let's take some time for you to reflect on this. What were some of the challenges you faced when adhering to your hepatitis C cure? And how did you overcome these challenges? I'm going to give you a couple minutes to write down your answers to these 2 important questions. Based on what other people say, there are some common barriers that people face when adhering to the hepatitis C treatment. So some people feel that hepatitis C is not a threatening disease, so don't feel motivated to take their medication all the time. There's also horror stories about liver biopsies and the side effects of older hepatitis C treatment that also might make people not want to take their medication. Some people also have difficulty finding a permanent place to keep their medication, especially if they move around from houses or where they sleep or stay from time to time. Did you experience any of these problems? It's also important to know that having hepatitis C in the past or being treated for it in the past does not provide you with immunity from getting it again. So it's possible to be cured of hepatitis C and then get reinfected. Because of that, it's important to continue to avoid activities that prevent hepatitis C. For example, it's important to constantly be using sterile syringes instead of sharing syringes. So one part of your job as a peer mentor will be to help participants engage in harm reduction to maintain their hepatitis C cure status. Remember, having hepatitis C does not make anyone less valuable as a person, and one of the most important jobs that you will have as a peer navigator will be to help participants feel supported as they go through their hepatitis C treatment. As a peer mentor, you have the important job of supporting your mentees overcome barriers to getting cured for hepatitis C and giving them information and support to prevent reinfection in the future. Thank you so much for joining me on this first training module. This may seem like a lot of information, but don't worry. You can always refer back to these training videos, your training manual, and when in doubt, always ask your study coordinator. I'll see you for the next training module.